Hello and welcome. I wanted to take a couple of minutes to talk to you guys about what is coming up over the next couple of weeks. We are entering a special unit of this course that's going to be dedicated to screening for alterations in mental health using some of the screening tools that are standard in the psychiatric community. So, here is a brief unit overview. So, as we know, we are entering the second half of our semester in our 4 semester-hour psychiatric and mental health nursing course. So, you, as undergraduate nursing students, are going to be provided with some foundational knowledge and skills that are related to assessing patients' mental status, screening for things like depression, anxiety, mood disorders, and substance use and abuse, as well as doing an ongoing assessment and coordinating appropriate care for behavioral health alterations that you encounter in your patients. This unit's going to be organized into 3 different modules that'll be delivered over 4 weeks. So, Module 1 is going to be done over 1 week of lecture and clinical study. And in this first module, we're going to expand your knowledge and skills in how to collect, interpret, and apply the information that you collect on patient and family psychiatric history, psychosocial and cultural factors, a mental status exam, and conducting a psychiatric review of systems so that you can gain subjective and objective findings, not just in their mental health, but also in their medical and medication related issues, so we can determine what kind of presentation they have and whether or not their complaints or symptoms are related to something in behavioral health or a medical symptom. In Module 2, that's going to be over the next 2 weeks following, and we're going to dive deeper into these screening tools like the PHQ-9, the GAD-7, the CSSRS, the MDQ, and things for substance use like the CAGE and DAS-10. And you're going to gain a lot more proficiency in how to deliver these screening questions, interpret the results, and apply your clinical judgment to see if any other screening tools are needed. Module 3 will be the final week of this unit, and that's where everything's going to be brought together, not just in lecture, but also in your clinical. And you're going to figure out how to take these findings that you've had and develop a multidisciplinary or interdisciplinary collaborative treatment plan where you can bring in other professionals to give them the most comprehensive care. Each module is going to correspond with what you're doing in the clinical environment, whether that be virtual simulations, scenarios, or actual patient interactions. The goal of this unit is to bring everything together that you've learned about alterations in behavioral health and figure out how to implement these skills and this knowledge into your personal nursing practice, regardless of what specialty or clinical environment that you end up in. Here's just a brief example of one of the activities that we'll do in Module 2, where you guys are going to pair up. One student will be the nurse, the other one will be the patient, and you'll be provided with a script as well as some background information, including the chief complaint, history of present illness, and some of their personal and family history, so that you can conduct a thorough interview and apply some of these screening tools, score them, and interpret them. We all have a collaborative academic partnership here, and that is built on positive and open communication between learners and between learners and faculty. If you have any needs, any questions, any difficulties that you run into, I implore you to reach out to me in a timely manner so that I can help you get through it. If you have any unique learning needs, you should already be in contact with the Office of Disability Services, but if anything comes up that is unforeseen, let me know and I'll help you get through it. And a quick disclaimer: much of the subject matter that we cover in behavioral health may be difficult to discuss or engage in for some students. It's a shared responsibility of all faculty and students to ensure that any interactions within the lecture, clinical experience, or the clinical portions of the course are respectful, confidential, sensitive of bias, and encouraging a growth and freedom of ideas. We have a zero tolerance policy for any discrimination within this course. And in the event that any student identifies a need for emotional or academic support or they need any resources, we have those resources and we'll be more than happy to provide them for you. Welcome to this unit, and I hope you enjoy.